My fellow Guyanese, welcome to today's briefing. I am Dr. Shamdeo Prasad, Chief Medical Officer, and we are continuing with our updates on our hinterland regions, recognizing that 3 of our 4 hinterland regions are affected by COVID-19, and our neighboring country, Brazil, is now the epicenter in the region of the Americas, registering more than 600 deaths in the past 24 hours. Today, we have with us Dr. Cassandra Abdul, Regional Health Officer of the Upper Pataro, Upper Siparuni Region Number 8, to brief us on the region's interventions. Dr. Abdul.
I'm Dr. Cassandra Abdul, and I'm the Regional Health Officer for Pataro Siparuni Region 8. Pataro Siparuni is one of the most beautiful regions in Guyana, and it's divided into 2 districts, Subdistrict 1 and Subdistrict 2. COVID-19 has taken over various countries worldwide, with Guyana being no exception. Even our neighbor Brazil has seen an increase in the number of infected persons and deaths, making them an epicenter. And this concerns us as a number of our villages in the North Pacaraimás, Subdistrict 1, borders Brazil. Pataro Siparuni began our preparations for COVID-19 in February, with Guyana's first confirmed case in March. The region has since established a task force for COVID-19. This task force meets every 7 to 2 hours or whenever necessary to discuss various issues that may arise, including resources for COVID-19, how to strengthen our borders, adjustments to our action plan, etc. Sensitization of the population has taken many forms, and the dissemination of information through flyer and poster distributions, as well as the use of other mediums such as social media and radio madio. We have established a regional hotline where residents in the communities can call us if they are experiencing symptoms or if they just have questions. Our number is 608-7517. A checkpoint has also been established at Sibali Landing, where commuters are screened just before crossing into Madia. There is also another screening area just as you enter the Madia District Hospital and at our airline service providers. We're also working towards strengthening our presence at the borders. We have quarantine and isolation facilities set up to cater for suspected or positive patients. We also have testing kits where samples can be taken from any suspected patient. So far, we've had 4 suspected cases with over 40 persons who had to be quarantined as a result. All results so far have been negative, and those persons in quarantine have completed their 14 days. We currently have 1 suspected case where the sample will be tested and contact tracing is being done. We have taken a total of 7 samples with no confirmed cases to date. We are also supported by the Madia Mayor and Town Council, the police and the militia, and even some business owners, who all aid in the dissemination of information to the community members, sanitization efforts, and donation of resources amongst other contributions. We've also conducted risk assessments, especially in the North Pacaraimás, engaging not only the health workers, but the 2 shows, and also other members of the communities so that they can better understand the importance of their role in helping us fight against COVID-19. Wash sinks have been set up throughout the various communities at health facilities, some offices, and businesses. The Health Emergency Operations Center has been providing protective wear for our rapid response team, with the region even purchasing any additional items that we may need, such as infrared thermometers. We continue to plead with the residents in the region and countrywide to take the necessary precautions, hand washing for at least 20 seconds to 1 minute. Use your hand sanitizers, remembering that they should have an alcohol content of 60 to 70% or more. Social distancing should be practiced 6 feet apart. And please only leave home when absolutely necessary. And if you must leave home, please use a mask in public. Please remember, we're all in this together.
Thank you, Dr. Abdul. Fellow Guyanese, as Dr. Abdul reported, our regions did initiate very early a gamut of measures to mitigate the spread of the coronavirus disease. But you recognize that we have absolutely no control over the situation in our bordering countries. The ministry is gravely concerned with the alarming situation emerging just across and along our borders, as our indigenous brothers and sisters are at extremely high risk for the influx of imported cases and for contracting the disease. To complicate the issue, we continue to witness the downright nonchalance of our residents who are intent on carrying on with their laissez-faire lifestyle, seemingly unappreciative of the selfless effort of our frontline workers who are risking their lives for our protection. Is this callous attitude going to persist until Guyana is swarmed with a high number of deaths? One death is already too many, and we have 11. Please note that our sister CARICOM countries have begun to see a decline in their numbers, yet we have an almost runaway situation. Over the past 4 days, 12 new cases were confirmed. Our efforts in limiting the spread of this disease are dependent on all of us if we do not want to end up, as the PAHO model indicates, with an exponential rise in positive cases and deaths that will overwhelm our healthcare system. We have recorded positive cases at the Palms Geriatric Home, so the ministry is working closely with the authorities there to ensure that our elderly are safe. We're also working feverishly with other facilities that house the elderly to contain the disease. Now for a global report. Globally, the statistics according to WHO are as follows. Total number of cases is 5,404,512 with 343,514 deaths. In the region of the Americas, the total number of cases is 2,454,452 with 143,739 deaths. The situation in Guyana is as follows. As of today, our COVID-19 deaths remain at 11 and the number of confirmed remain at 139. To date, the total number of persons tested is 1,500, with a total number of negative cases being 1,361. We currently have 67 persons that have recovered, 61 active cases in institutional isolation, 2 patients in the COVID ICU, and 8 persons in institutional quarantine. Yesterday, we celebrated 54 years of independence, and we are hoping that the entire Guyana will continue to enjoy this beautiful country of ours. However, the survival of this nation is in your hands. I hope that you choose wisely. So, stay home, stay safe, and continue to pray for our nation. I thank you. Good afternoon.